So, Mr. Turner, I have your notes here, but I would like to hear things from your perspective. How all this started. What treatments you've had, anything you think I should be aware of.
Well, where to begin? I should explain that I've been struggling with asthma for quite a long time, ever since I was a teenager actually, and I'm 45 now. So I was used to a certain level of discomfort. You know, having to carry an inhaler everywhere, avoiding strenuous activities, and dealing with the occasional asthma attacks. But recently, things have taken a turn for the worse.
I see. What happened exactly?
A few months ago, I started experiencing more frequent asthma attacks. I used to get them maybe once every few months, but now it's almost every week. And it's not just that. My general breathing has become more labored, even when I'm resting. It was really alarming, especially since I work as a construction supervisor and need to be physically active.
That sounds difficult. Did you seek any treatment for this worsening condition?
Yes, I did. I went to my regular doctor and she adjusted my medication. She prescribed a stronger inhaler and suggested some lifestyle changes, like avoiding dusty environments and staying indoors on days with high pollen counts. But it didn't seem to help much.
And then what happened?
Well, after a particularly bad attack that landed me in the emergency room, the doctor there did some tests and found out that I might have developed chronic obstructive pulmonary disease on top of my asthma. That was a real shock to me. They did some lung function tests and confirmed it.
I can imagine how shocking that must have been. Did they suggest any further treatment?
Yes, they did. They recommended starting pulmonary rehabilitation, and I've been attending those sessions. They also put me on some new medications to help manage the COPD. It's been a lot to take in, but I'm doing my best to follow their advice.
How are you feeling with the new treatments?
The rehabilitation sessions have been helpful. I've learned a lot about how to manage my breathing and conserve energy. The new medications seem to be working too, but I still feel quite limited in what I can do physically. And there's another issue that's been bothering me.
What is that?
Lately, I've started to notice a bit of chest pain, especially when I'm lying down or after eating a large meal. It's not severe, but it's there. I've also been feeling more fatigued than usual. Even after a good night's sleep, I wake up feeling tired. I'm worried it might be something more serious.
I understand your concern. Chest pain and fatigue can be symptoms of various conditions, and it's important to investigate them further. Let's start with a detailed examination and possibly some tests to determine what's causing these new symptoms.
That sounds good, doctor. I really hope we can figure this out soon. It's been quite overwhelming dealing with all these health issues at once.
I'm sure it has been. We'll do our best to get to the bottom of this and find a way to help you feel better. Let's begin with your examination.
So, Mrs. Collins, I have your records here, but I would like to hear things from your perspective. How all this started, what treatments you've had, anything you think I should be aware of.
Well, where to begin? I should explain that I've been managing hypothyroidism for many years, since my early 30s, and now I'm 52. So I was accustomed to dealing with symptoms like weight gain, feeling constantly cold, and general sluggishness. But recently, things have worsened.
I see. What exactly happened?
A few months ago, I began experiencing severe fatigue. Despite my usual medications and lifestyle adjustments, nothing seemed to alleviate it. Additionally, My hair started falling out more than usual, and my skin became excessively dry. It's been quite distressing, especially given that I work as a teacher and need to be alert and energetic.
That sounds challenging. Did you seek any treatment for these worsening symptoms?
Yes, I did. My endocrinologist adjusted my medication, increasing my levothyroxine dose, and recommended dietary changes to support thyroid function. Unfortunately, the adjustments didn't provide much relief.
And then what happened?
After experiencing increased exhaustion and occasional heart palpitations, I returned to my doctor. They conducted blood tests that revealed my thyroid levels were still unstable, and they also investigated for signs of autoimmune issues. It turns out I may have developed Hashimoto's thyroiditis alongside my existing hypothyroidism. This news was quite surprising. An ultrasound confirmed the diagnosis.
I can imagine how unexpected that must have been. Did they suggest any further treatment?
Yes, they did. They recommended switching to a different thyroid medication and scheduling more frequent follow-up appointments to monitor my thyroid levels closely. I've been adhering to their recommendations as best as I can.
How are you feeling with the new treatments?
The new medication has offered some relief, and I've learned more about managing my symptoms effectively. However, I still struggle with low energy levels. Additionally, I've noticed some joint pain, particularly in my knees and wrists, and increased anxiety and disrupted sleep patterns. Even after a full night's rest, I often wake up feeling exhausted. I'm concerned there might be underlying issues causing these symptoms.
I understand your concerns. Joint pain, anxiety, and disrupted sleep can stem from various conditions, and it's crucial to investigate further. Let's begin with a thorough examination and consider additional tests to pinpoint the cause of these new symptoms.
That sounds reassuring, Doctor. I hope we can uncover the root cause soon. Managing these health challenges has been overwhelming.
I assure you, we'll work together to find solutions and improve your well-being. Let's start with your examination today.
So, Mrs. Dove, I have your notes here, but it would be good to hear things from your perspective. How all this started, what treatments you've had, anything you think I should be aware of.
Well, where to begin? I should explain that I'd been suffering with endometriosis for quite a long time, ever since my son was born, actually, and he's at university now. So I was used to a certain level of discomfort, feeling bloated a lot of the time, getting the occasional bouts of nausea and feeling quite a bit of fatigue.
Right.
Anyway, after a while, I also started to get pain in my lower back, and that gradually got worse and worse. I was working as a preschool teacher in those days and had a young family of my own. It was a tough time. In the end, I had to give up my job. Anyway, to cut a long story short, I was eventually diagnosed with cervical cancer. I was fairly lucky, I guess. It hadn't advanced too much, and I was advised to have a hysterectomy. Although I was out of action for a while, it all went relatively smoothly, and of course it also sorted out my other problems. So for a while I was relatively well. My kids were at school by this time, so I was able to start my own business, working online as a recruitment consultant. I'd put both illnesses behind me, and I was feeling very positive.
But then you started to develop other symptoms.
That's right. Those feelings of fatigue started coming back. I'd find I was exhausted after a full day of online meetings. If I did have to go anywhere and do anything, like attend the occasional conference, especially if it involved driving any distance, that would just wipe me out. So something obviously wasn't right. Anyway, I went to see the doctor, and he said that it sounded like I might have iron deficiency anemia, and he did some blood tests. But when the results came back, I was really surprised to find I actually had iron overload. And the next step was to test for hemochromatosis. And of course, that came back positive. The first thing the doctor asked was whether anyone else in the family had ever had it, because it can be genetic. Anyway, I didn't know for sure because I was adopted as a baby. And I'd only just recently traced my birth mother and started to get to know her. Anyway, she was able to confirm that some cousins, whom I'd never met, had indeed got the same thing.
I see. So, have you been having treatment?
Yes, I was told that the only option was venesection. That came as a bit of a shock, and I had it every week initially. Then once a month, and I've been going every 3 months for some years now. I mean, it's fine. It hurt a bit at first, but I'm left with quite a bit of scarring on the arm where the needle goes in. But it's something I can live with. For the last few years, I've been back to my usual energetic self.
So, what brings you here today?
Well, I've started to develop some other problems, and I'd just like to have them checked out. I mean, I'm not getting any younger, so these could be completely unconnected with the blood problem. Anyway, the first thing is that I've started to get a bit of stiffness in my joints. It's particularly noticeable in my fingers, but I think it's there in my knees too. Then I also seem to be getting more thirsty than usual, and it doesn't seem to be related to how much I drink. And the other thing is that I get a bit short of breath sometimes, even when I haven't been doing anything particularly strenuous. You know, just walking the dog or washing the car, and it suddenly comes on. None of these things is a big deal, but I've just noticed the change.
Sure. I'll ask you a bit more about those symptoms in a moment, but what I'd like to do first is have a listen to your chest.
Hello, Mrs. Tanner. Pleased to meet you.
Hello.
Do you mind if we start off by getting some background to your condition? Just in your own words, could you talk me through the reason you're here and how it all started?
Oh, please call me Kathy.
Right.
So, until 2 years ago, my husband was in the army.
Right.
We lived off base, and I had a job which involved a lot of driving. Whenever I was in the car, I noticed that my neck would get pretty stiff at times.
Right.
It was hard to turn my head. To cut a long story short, when my husband left the army, we moved to a new house. My neck pain was still a problem, so I decided to visit an osteopath.
Right.
He tried to fix the problem by a neck adjustment, but actually it just made things worse.
Oh, dear.
I found I was losing flexibility in my neck. I began to use a heat pad, which did help at first.
Good, but was not for long?
No. About a month or two on, I started to get this sort of feeling that something was pulling my head over towards my right shoulder.
Right.
It was painful and embarrassing because I couldn't keep my head straight.
Of course.
I'd managed to hide it from everyone around me until then. About this time, one of the doctors I'd seen thought physiotherapy might help and sent me to a nearby clinic. So I started going in regularly for treatments. And one day, the head of the clinic looked at me while the therapist was trying to position my neck and whatever. And he said, "You know what your problem is, don't you?" And I replied that I didn't. And he told me that I had spasmodic torticollis, and I had no idea what that was.
So what happened then?
So he says, "Oh, it's untreatable. You just have to learn to live with it." I went home in pain, feeling depressed and hopeless.
Yes, of course.
He was just so unsympathetic and unhelpful.
Well, I'm sorry to hear this.
Thanks. So my diagnosis of spasmodic torticollis was in June. So I began to research, what I could do. I tried chiropractic treatment until December. It cost a fortune, but did no good.
Oh, dear.
The pulling and pain continued to increase. I saw a couple of neurologists, and I was put on a drug called baclofen. But it really didn't make any difference.
Yes, that wouldn't do much for your condition.
Oh, right. Anyway, the one really good thing I did at that time was to join a support group for spasmodic torticollis patients. So at least I knew I wasn't alone with the condition. But mostly, I just sat at home a lot. In order to get a bit of pain relief, I got myself an orthopaedic chair, and that did give me some support.
Right.
In November, I saw something in a magazine in the medical section. It mentioned some new treatments being done at the university hospital to treat things like spasmodic torticollis with Botox. We mentioned this to our GP, got a referral, and in December, I had the first injection in my neck.
And how did the treatment go?
Well, the injections really helped the pain, My head returned to almost a normal position.
Right.
It did give me a few problems, like problems swallowing, but that was okay. I thought I'd received a miracle cure. I was devastated when everything started to come back like before. And I went back to the hospital in May. At this time, the results weren't quite as good. Even though they'd upped the dosages, I ended up having 9 lots of injections, plus the, various oral medications. So I can't remember what they were.
No, it doesn't matter.
But nothing really made much difference. I just got more and more confused, and loss of memory became a problem too. Just for pain relief, they ended up giving me a pump so I could give myself morphine. Finally, I saw something in my ST support group's magazine about a relatively new type of surgery being done by a local neurologist, and that would be you. So here I am.
And we will do our best to help you. Now, just a few more questions.
Mrs. Kennedy?
Yes.
I'm Dr. Jarvis.
Hello.
Sorry to keep you waiting.
Okay.
Now, can you tell me what's brought you here today?
Well, I got back from holiday 2 weeks ago, and I've been feeling awful ever since. It was a long-haul flight because we'd been to South America, and when I got back I felt awful. I thought it must be jet lag, but brutal, much worse than I remember having before. Anyway, I thought I'd get over it, but it actually got worse. After a few days, I was getting bad chills and non-stop shivering and achy muscles. I just felt lousy. I mean, normally I'm pretty healthy. I don't get a lot of illnesses. So I started to worry. I thought maybe I got meningitis. So I rang the doctor. When I told him where I'd been, he said I should come in and see him because it might be malaria. So I said, well, it can't be because I've been taking Malarone. I started on that 2 weeks before going away. I tried Lariam a few years ago, but it gave me really odd dreams, so I didn't want to take that again. Anyway, the doctor said some sorts of malaria are resistant to these drugs, and I know I did get a few bites when we were there. He gave me some pills to take for 3 days, just in case it was malaria.
Right. Can you tell me what they were?
Art something.
Artesunate.
That's right. And something else. Hang on, I've got the box here. Mefloquine.
Okay.
So I went home and I took the pills, but I didn't feel any better. In fact, I got worse. I felt really weak and I was sweating buckets, just dripping with it. I finished the pills yesterday morning. Since then, I've been really bad. I haven't been able to keep anything down. I was throwing up all day yesterday and had the most splitting headache. I've never had anything like it. So I rang the doctor again and he said the blood test had come back negative. But if I wasn't feeling better today, I should come into the emergency department and get some more tests done.
Right. Well, I'll just do a brief examination.
Okay.
You want to pop over there? Okay, so your skin's a good colour. I can't see any sign of jaundice, and your breathing's sounding pretty good. You haven't had any episodes of breathlessness, have you?
No, but yesterday my heart was really racing.
Yes, there is some evidence of that now.
And something else. All this week I felt as if there was something scratchy in my eyes, like sand or something, and they feel really dry.
I see. And have you had any abdominal discomfort?
Well, there's no pain, but I don't have any appetite. I can't really keep anything down, like I said.
Right. Now, apart from taking the anti-malarials, did you have any vaccinations before you went away?
Yeah, I had all the injections. Typhoid and what else? Not yellow fever, because I'd already had that before. But I did have one for hepatitis A.
Yeah.
And they were fine. I don't usually have any problems with things like that. Then while we were away, I did get cold sores all over my upper lip. I've had them before and I'd got some over-the-counter stuff for them, so I just used that.
Right.
Apart from that, I was fine during the holiday. I'm normally very healthy. I did have breast cancer a few years ago. That was in 2011. I had a lumpectomy, so I was taking tamoxifen for 5 years. But I don't have to take it now.
Okay. So it's possible that this might be a reaction to certain drugs, but we'll need to do some more tests first.